So today we are going to talk about the cough. So what is cough exactly? So cough is basically a reflex of respiratory tract. We all know that. So the cough is usually divided into two types of cough. There can be either dry cough or there can be either wet cough. And the wet cough, we can say that it is a productive cough, means when the mucus production is coming out and something else. And whereas the dry cough is also known as the non-productive cough. Okay, so let's not go into too much detail. This video is just for revision purpose. So in cough, a cough can be acute cough, or it can be subacute cough, or it can be chronic cough. Okay, so the acute cough, when we say that if the cough is less than for 3 weeks, suppose, so that is acute cough. And if the cough is for 3 to 8 weeks, then it is subacute cough. And if it's more than 8 weeks, then that will be chronic cough. So the acute cough, that will be mainly due to, I'm sorry, I just spoke in Hindi. So basically, by mistakenly. So basically, the acute cough is the main reason is infection. Yeah, any infection that can lead to cough. And another reason is like for subacute cough, another reason can be infection also, but can be post-infection also. And for chronic cough, it can be either any illness, for example, long-term illness, or it can be either it might be that the patient is on AC inhibitors, or it can be that the patient is a smoker. Okay, so that can be the reasons. So basically, what drugs we will use here? So for in case of dry cough, if we say, so for dry cough we can use antitussive drugs. Like only antitussive drugs are used for dry cough. These are, for example, codeine, or they can be dextromethorphan. Or dextromethorphan is generally used for mild cough. Okay, it is used for mild cough basically. And we can say another one is noscapine, and also the codeine is used for mild to moderate cough. And further there can be like folcodeine, and so many drugs, folcodeine, then diphenhydramine, okay, then chromoline, then lignocaine, buivacaine. These drugs are used in the dry cough basically. And another one, mainly codeine is used and dextromethorphan are used mainly. And another thing is that for the antitussive, there can be a complication, there can be a side effect, not complication, there can be a side effect, that can be constipation or other GIT problems. For if you talk about the drugs for wet cough, so for the wet cough there can be so many varieties of drug. For example, potassium iodide, or there can be guanifenicin, or there can be like uh, other drugs, like for example mucolytics. Yeah, mucolytics, which makes our mucus like less viscid. Okay, so that can be like acetylcysteine, for example, and it might be bromohexine, or it might be the ambroxol. Okay, so these are the drugs for the cough.